lab. So with our Path and Lab, we know that's our 80,000 series. With Path and Lab, you have a lot of different sections of your pathology and laboratory section. So just again, it's just one of those things that using your index in the real world is going to help you figure out where you are. Or even your table of contents within your CPT manual is going to help you kind of find the different sections pretty easily. So let's do number one. Let's just jump straight into number one. And let's look at this from a coding from scratch standpoint. Okay. So again, we're just going to kind of ignore the multiple choice down here for a second. A patient presents with right upper quadrant pain, nausea, and other symptoms of liver disease, as well as complaints of decreased urination. Her physician orders an albumin, bilirubin, both total and direct, alkaline phosphatase, total protein, alanine aminotransferase, aspartate aminotransferase, and your creatinine. So, what CPT code or codes are we going to report? So, when we see large numbers of labs that are billed, these are typically what are known as your organ or disease oriented panels. Okay. So when you are looking at your disease panels or your organ or disease oriented panels, those are going to be the very first section in your CPT, in the pathology and lab section. So if you have the 2024 CPT manual, it's going to start on page 610. So we know that they are showing symptoms of liver disease. Okay. So if you are familiar enough with your Path and Lab or organ and disease oriented panels, you'll know that you do have a section or a group of codes that are going to refer to renal function or a hepatitis panel. Okay. So those are 80069, 80074, and 80076. When you have your organ panels that are billed, the only time that you can bill an organ panel is if every single code or every single test that is listed within the panel has been done. So we are looking for all of these tests here, the albumin, all the way through the creatinine. Okay. So all of this is what we're looking for so far. So we can look at the 800. Let's do either, yeah, let's look at the 80069 first, okay, because that's our renal function panel. We know that renal equals our liver. So we have an albumin. So we've got that one. Did we order a calcium? Is there anything in here that indicates that they ordered a calcium?
No.
Right. So we're not going to use 80069 because we did not do a calcium, so we can't report the entire panel. Then let's go down and look at 80074. 80074 is going to be a hepatitis panel, and that's looking for different antibodies for the different types of hepatitis. So that's not what we did here either. 80076, on the other hand, you have a couple different tests. So we have albumin. So we've got that one. It talks about bilirubin, both total and direct. So those are going to be two separate tests. You've got your total bilirubin and your direct bilirubin. So we can check those off. The phosphatase alkaline, we did order that. Your total protein, we ordered that. The next one on the list is the transferase alanine amino, which is the next one here on our list. And then the last one within the panel is the transferase aspartate amino, which is the second to the last one on the list. So we've met all of our components of 80076. So we know we can bill at least 80076, right? So we won't have to report all of these codes individually because they are best represented by that panel code. So we are going to cross out letter A.
I think I know the answer now.
Okay. So then we need to look at, we don't report a 22 if we do additional codes because we would just report what the additional lab is in addition. And then we can go look at the 82565 and make sure that that represents our creatinine. So Sylvia, in the index. So in this case, I didn't go directly to the index because I was looking at our panels, and our panels are the very first, um, the very first section in the Path and Lab. But whenever you are looking in your alphabetic index, if you're looking at a panel, you would look at blood test as your main term, and then panel underneath that. And then that's going to give you whatever the codes are for each one of the different panels. Okay. Now, if you're looking up, because we have to also report our creatinine, right? So we have to report that as well. When we're looking in the alphabetic index for creatinine, then you're just going to look up whatever that component is that we're testing for. So in this instance, we'll look at creatinine in the alphabetic index. And then it doesn't specifically state blood or urine. So we'll go to the 82553 and the 82554. Hang on, why is it? Am I looking at the right? Yeah, we're looking at creatinine. Oh, I was looking at creatine. Sorry. My eyes were playing tricks on me. Creatinine. And then here, let's see. Yeah. So we can assume that it's a blood because they're not saying that it's otherwise. Because if we're doing a blood panel, right, then we're going to be looking at blood for all of these conditions. So we'll look at creatinine and then blood, and it's going to take us to the 82565. And then our code description for 82565 is for our creatinine of blood. So then we're going to report two codes. We're going to report one code for all of these that are in green, because all of those are found within that acute hepatic function panel. And then the creatinine is able to be billed separately because it's above and in addition to that blood panel. Any questions on that one? So again, if you're doing a blood panel, every single component of that blood panel has to be run in order for you to bill for that blood panel. If even a single component of that is not included in the order, then you should report each one of them individually. Okay. Let's go to number 2. Patient has a cytopathology study performed by fine needle aspiration. The results are quite unusual and are considered moderately complex. The slides, as well as a copy of the pertinent information from the patient's record, are sent to another cytopathologist for consultation. The consulting pathologist reviews the slides and then reviews the patient's chart material. A report is then sent back to the original pathologist with the findings. And our medical decision making is going to be considered moderate. So, what type of pathology service do you think we're reporting with this scenario? So if they are getting the slides to the cytopathologist for a consultation, right? Yep. So they are doing a pathology consultation. So let's look in the alphabetic index under consultation. because that's what we're doing. Underneath consultation, we're doing a clinical pathology consultation. So our codes that it's going to send us to is 80503 through 80506. So let's go find those codes. Okay. So with our clinical pathology consultations, in this scenario, they do give us our medical decision making level, right? They're telling us it's a moderate level of decision making. If they do not give us the level, then we are going to have to level it based on the medical decision making table. And those are on page 626 and 627. Okay. We'll go over more medical decision making in 2 weeks whenever we go over E&M. But just from a standpoint for this one tonight, this one is going to be just a moderate level of medical decision making. So which of the codes of 80503 through 80505, which one of those three codes is going to represent a moderate level of medical decision making?
80504.
Yep, 80504. Okay. So like I said, when we go into E&M, we'll kind of dive into, we'll probably spend 2 full weeks on E&M. So we can make sure that we understand how to level things correctly, what to pull out and things like that. But we will really dive into how to level MDM in a couple of weeks. But just from this standpoint, we need to recognize that this is for a consultation and not for just a pathology that's your gross and microscopic exam. Okay. Any questions on that? Okay. Let's look at number 3. A pregnant patient is tested for a serologic blood type and RH factor. So what code or codes are we going to report? So let's look at this one from a process of elimination standpoint. Okay. Process of elimination, we have 2 options that have the same code, right? We have B and C that both have 86900. So let's go look at 86900. And our code description for 86900 is blood typing serologic ABO, right? So that's what that ABO means, is it's telling us whether they have the type A, type B, type AB, or type O. So it's indicating, it's going to tell us what the actual blood type is, not the positive or the negative. That's going to be our RH factor. But the ABO is going to just tell us what type of blood that they have. Okay. So 86900 we know is one of our answers. Now, from a testing standpoint, oh, I did the wrong thing. I wanted to cross that out. From a testing standpoint, okay, we know that we need more than just the blood type because they also did the RH factor, right? So we can go look at that 86901, make sure it appropriately reports that RH factor. Again, that's going to tell us whether it is positive or negative. So 86901 is giving us our RH factor. So we should choose letter B as our answer because we need both the type and the RH factor because that's what is ordered. Okay. Any questions on that one? Okay. Question number 4. a 35-year-old type 2 diabetic is feeling weak, the physician performs a stat glucose test in which a finger stick is done, placing the drop of blood on a reagent strip. The test indicates that the patient is hypoglycemic. The physician gives the patient some glucose supplements and performs another stat glucose test using the same lab as the test as they had performed 30 minutes later, or 30 minutes before. The second test shows that the glucose levels return to normal. So how will our lab tests be reported? Okay. So again, let's look at this one from a process of elimination standpoint, from a testing standpoint. We have 82947 N2, and then we have 82948 N2. So let's go look at the 82947 and 48. So which one do you guys think we should use, the 82947 or the 82948 based on our scenario? Okay. Deisha says 82948. Okay, we've got another 82948. Yep, because 82948 indicates that it's a reagent strip versus actually using a blood test that would be sent off to the lab. That's going to be your 82947. So then the next thing that we need to consider is, do we need the 91 modifier or do we need the 76 modifier? So let's go look at the inside of the front cover. And what's the difference between the 91 modifier and the 76 modifier?
91 is a repeat. And
Well, 76 and 91 are both repeats. They're just for different
oh,
types of services. Yep.
dumb me.
No, you're fine. You're fine. So yeah, Disha, one is a lab and one is a procedure. So your 76 should be done on procedures that are like in your surgery section and medicine section. Whereas anytime we're doing a repeat lab, it should be that 91 to indicate that it was a repeat lab on the same day. Any questions on that one? Okay. Number 5, a patient arrives at the ED. It appears that the patient has been suffering from periods of disorientation, persistent stomach ache, fatigue over the last several months, but the persistent patch of dark skin that appeared on the patient's chest is what has prompted the visit. The treating ED physician orders a stimulation panel for adrenocorticotropic hormone, or ACTH, consisting of 2 cortisol injections, 60 minutes apart. Blood tests reveal that ACTH levels are at 300 nmol per liter, and a diagnosis of the patient they diagnose the patient with adrenal insufficiency. So what are our CPT codes for the lab services? So when we're looking at stimulation panels, okay, let's look at this one from a coding from scratch. Milvia, yes, your 91 is always going to be attached to your second code. Yeah. And they should be the same CPT code. So it really doesn't matter if it's the first or the second, but it should always be attached to the one that's sequenced second. Yeah. So on this one, your ACTH stimulation panel, we're going to look at main term panel in the alphabetic index. And then underneath panel, we're looking at a stimulation panel. Okay, so we can get all of our words here, our stimulation panel, and then our ACTH, which is that adrenocorticotropic hormone. And then we've got three codes for an ACTH stimulation panel, right? We've got 8400, 8402, and 8406. So the difference between the 8400, 8402, and 8406 is going to be for what the type of deficiency is that we're looking for. Okay. And so they diagnose them with adrenal insufficiency. So which code do you think we should use? Actually, no. Yeah. Yeah, for the adrenal insufficiency.
8400.
Yep. 8400. And that's going to be for the adrenal insufficiency. And then even underneath that, it states that the panel must include the cortisol injections times two. And so we have that here that two cortisol injections were performed 60 minutes apart. Okay. Any questions on that one? Perfect. Number six, a patient will be undergoing a transplant and needs HLA tissue typing with DR/DQ multiple antigen and lymphocyte mixed cultures. So, how are we going to report these? Okay. So, this is a scenario that if you see this in a testing world, you're going to be you're probably going to go, there's a whole lot of words, there's a whole lot of acronyms, I don't know what any of these mean, right? And that's totally fine, because from a testing perspective, okay, you will have your multiple choice and we can work this with process of elimination. So we have three codes that have your 86817, okay, or you have two options that have 86821. And then you've got two that are pretty similar. You have 86806 and 86805. So we can do process of elimination a couple different ways. So let's look at the way that I would do it is the 86817. No, actually, hang on. Let me think about this. I would go look at the 86805 or the 86806, because those are going to, it's either going to rule out two or it's going to confirm two. Whereas if we start with the 86817, we're only going to rule out one, right? If it's positive or if it's confirmed. So let's go look at the 86805 and the 86806. So our 86805 is a lymphocytotoxicity assay, visual crossmatch with titration. And then your 86806 is without titration. So did we do any lymphocytotoxicity? No, right. Even though we have lymphocyte mixed culture, that's going to be different. So we're going to be able to automatically rule out two options. Okay. So then we just need to determine, is it, because 86821 is in both. So then we just need to determine, is it the 86817 or the 86816?
86817.
Okay. So 86817 is your HLA typing. Okay. So we've got that part of it. And then your 86817 is DRDQ multiple antigens. So we've got our 86817. So we know from a testing standpoint that our letter B is our option. However, if you want to, you can go look at your 86821 and make sure that that includes the lymphocyte culture, the mixed culture, which it does. Okay. But from a testing perspective, we've got our letter B that's going to represent the HLA typing, the DRDQ multiple antigen, as well as that MLC or the lymphocyte mixed culture. Okay. Any questions on that one?
Yes, I had a question, Tiffany.
Okay.
If you had to look up in the index, I'm getting lost in that one. Like I'm looking under blood testing, and then I looked under tissue type, and I couldn't find it, or probably I'm misreading it somewhere. Um,
Um, let's see. Let's look under tissue. Yeah, so then underneath tissue, and then you go to typing, you have a human leukocyte antigen or that HLA.
oh, okay, got it.
Yeah, yeah.
Okay, got it. Thank you.
You're welcome. Absolutely. Any other questions on that one? Okay. Oh, Dawn, did you find it under a different one? So you went under culture, tissue, and then homogenization. Is that what you're saying you went? Hmm. I don't know that I would have gone underneath culture. I don't know. I mean, if that works, then that works. Let me look at it real quick and see. That's the nice thing about the alphabetic index is it's like multiple different ways. So under culture, and then would you say culture, tissue, and then yeah, homogenization. Your homogenization gives you 87176. No, you're fine. I know sometimes the numbers run together and they mix, like they jumble. I do it all day, every day, and I have to like double check like majority of it. So it's totally fine. And then who was it that said Sylvia? So to me, when you're looking up CPC, it's usually not faster to go to the index because you can usually rule out two options pretty quickly. Um, but I mean, if you're comfortable enough with the index and you think that you can do it timing wise, do it both ways and see which ones are going to be faster for you. Sometimes your index will be a little bit faster. I'm a lot faster in the index than ICD-10. So whenever I do my process of elimination, I use my alphabetic index and I can I can rule it out pretty quick. CPT index is a little bit not as straightforward because there's so many different ways. So really it's just whatever you're comfortable with. Okay, let's look at number 7. So a patient has a partial removal of his lung, which is sent in for gross and microscopic examination. The pathologist also did gross and microscopic exam on biopsies for several lymph nodes that were located in the patient's chest, and that's all placed in one container. A consultation is performed on a tissue block of a single specimen intraoperatively by a frozen section, and the pathologist also performs a trichome stain. So again, let's look at this from a process of elimination standpoint because there's a lot of things that they did here, right? So try to make it not as intimidating from a test taking standpoint. You have 88309 that's in 3 of our options. Okay. So let's go take a look at 88309. When we are looking at our clinical pathology codes, okay, not only do we have to make sure that our specimen that we're looking at is correct, but there are going to be instances where you're going to have 2 different levels that are going to be on the same type of specimen, but it's going to have a different level for a different indication. Okay. So in this one, we're looking for either a lung, we're looking for lymph nodes. Well, a portion of the lung. Let me rephrase that. A partial portion of the lung. Lymph nodes, for our surgical pathology. So in 88309, let's go look at the list that's in 88309. Is there a lymph node in 88309?
Mm-mm.
Okay. So is our lung in 88309?
Yes, but it's total and not partial.
Well, it says total or a lobe or a segment resection. So if it's a partial removal, that's going to be known as a segment resection. Okay, because they're only taking out a portion. They're not taking out just a biopsy of it. They're actually removing a portion of it. So it's going to be a segment. Yeah. So we would be able to use 88309. Okay, for the removal of the lung. So we're going to rule out letter C because we know that we need 88309. Now the question is, we need our lymph nodes. Okay. What is 88307 where our lymph nodes are found?
Mm-hmm.
Okay. So we know we need 88307 for the lymph nodes, and there's not an 88307 in either of the others. Actually, no, hang on. Just kidding. 88307 has lymph nodes, but it's for a regional resection. Okay. So see where your 88307 may not be it because we didn't do a regional resection of the lymph nodes. So then let's go find the one for the lymph nodes that are for a biopsy. So see how we need to not only just look for lymph nodes, but we need to also indicate what the reasoning or the type of examination is that we're doing. So your 88305 indicates that your lymph nodes are done for a biopsy versus 88307 is a lymph node for a regional resection. Does that make sense? Okay. So we would not use 88309 times 2, okay, because we can't report 2 units of 88309 and either A or D. And then we need to make sure that we report the 88305 for our lymph nodes as letter B. So from a testing perspective, we don't have to worry about the tissue block, the frozen section, or the trichrome stain, because all we had to do from a testing perspective is figure out which appropriate surgical pathology codes we had for the lung and the lymph nodes. Any
Tiffany,
questions? Yeah.
I have a question. When you said 88309, why, I mean, just for curiosity, times 2, that we cannot use that?
Because we
couldn't.
didn't have 2 separate specimens
Oh,
that would
okay.
fall under the 88309. Yeah. So
Okay.
our lymph
Okay.
nodes have to be reported with the 88305 because
Okay.
88309 is not going to have a lymph node specimen in it.
So that one is only really for the
It's only for
lung.
the lung. Yep.
Okay, gotcha.
Yep.
Okay.
Yep.
Thank you.
You're welcome. Good question. Any other questions on that one? I know surgical pathology can get a little tricky. Like I said, you have to not only look at the location where the tissue came from, but you have to look at the reason why we have the tissue, whether it's a resection, whether it's a biopsy, whether it's I think there's 2 different fallopian tubes, one for a biopsy. No, it's not that. It's the breast tissue. One of them you have a breast biopsy or a breast reduction mammoplasty, and then the other you have breast excision of a lesion or a breast mastectomy. Okay. So don't just find the area that the tissue came from or the type of tissue, but we have to also sometimes understand the reason for why we have the tissue, or why that tissue is extracted. Okay. Any other questions on number 7 with surgical pathologies? Okay. Milvia, so are you asking, are there possibly cases when you can use 2 units of them, or 3 units? Yes, there are going to be instances. So let's say, for instance, you have 3 total types of tissue. One is your lung wedge biopsy, one is a pancreas biopsy, and one's a testes biopsy. Because all 3 of those specimens fall underneath 88307, you could report all 3 of those with 3 units of 88307, because you're going to report 1 unit for each of the tissues that you're looking at. Does that make sense? Okay, perfect. Number 8, in a legal hearing to determine child support, there's a dispute about the child's paternity. The court orders a paternity test, and a nasal smear is taken from the plaintiff and the child. The plaintiff is confirmed as the father of the child. So let's look at our CPT and ICD-10 CM codes for the paternity testing of the plaintiff. So do we want to let's look at ICD-10, because we haven't done any ICD-10 tonight. So let's look at ICD-10. And let's look at this from a scratch. Okay. So they are there to determine the paternity, correct? So they're not there for a condition. They're not there for an illness. So when we're looking in our alphabetic index, we're going to go to encounter for. Underneath encounter for, you would go to administrative purposes only, and then paternity testing. And what code does it give us for that? So encounter
02.81.
for, yep, encounter for administrative purposes only, and then paternity testing. And that's going to give us the 0281, Z0281. Everybody see that? So we're
Yep,
going
got it.
to, yep. So we're going to rule out A and D. So then let's flip to our CPT manual, or switch to our CPT manual. And then in the alphabetic index, we're going to go to paternity testing. Simple, straightforward. We're not going to have to go to a bunch of different places, just paternity testing. And then we have 2 codes for paternity testing. We have 86910 and 86911. So what's the difference between 86910 and 86911? Yes. So 86900 is going to be for a blood type. Yep. And then your 86910 is for the blood typing for your, wait, they do a nasal smear. I just caught that they did a nasal smear, but they have nasal typing. Dr. Stutzman, can you, and I don't know if you're pathology or not, but do you know if can you get blood typing from a nasal smear? Doctor of music. Okay, then never mind. You would not be able to tell me which one. Okay. Let me look at that. But from a testing perspective, then we would go with whatever is closest, right? Um, yeah, I was gonna say neither one of them says nasal smear. I wouldn't think you would be able to get blood typing from a nasal smear, so I'd have to look at that and um see um what I can look at because I don't know that I've ever caught that before. But from a testing perspective, we know 86900 is only looking at blood type the ABO versus the 86910 is actually for paternity testing. So in that case, you would choose your 86910. Yeah. And then because they are there in the court and it's a court mandated service, right, for the child's paternity, then that's why we append our modifier 32 for that mandated services. Yep. Okay. Any questions on number 8 besides that potentially I need to look and see if you can get a nasal smear from or a blood typing from a nasal spear? Any other questions on that? Okay. 89190 is a nasal smear. Is that what you said? Hang on, let me look. 891. Hang on, I'm flipping to it. My brain's not wanting to make sense of numbers tonight. 89190 is a nasal smear for eosinophils. So eosinophils are going to be more for like if you're looking at I think eosinophils are your white blood cells. My brain's not wanting to make but I think I know it's um, part of your immune system.
Okay, so like 2 down from that in parentheses, it says for paternity tests, use 86910.
Does it say that? Hang on. I flipped my page back. Let me get back to that number. 89190. Yes, paternity test. It says you use 86910. Okay. I guess you can get blood typing from I don't know that I ever knew you could get blood typing from a nasal smear, a spear. A nasal smear. My words are not wanting to come out tonight. Okay. So yeah, 86910 is going to be your correct code. Okay. Number 9. Was that Jennifer that was saying that? Thanks, Jennifer, for pointing that out because I hadn't gone that far into depth into it. Number 9. So a left breast biopsy is performed on a mass, and the surgeon requests a frozen section examination of the specimen to determine whether more extensive resection is appropriate. The frozen section reveals no indications of malignancy, so no other specimen is obtained, but the remainder of the biopsy specimen is sent for further testing and examination, including decalcification. The results indicate breast fibrosclerosis only. So what CPT and ICD-10 codes are we going to report? So let's pull out. Go ahead.
Fibrosclerosis. That should
Okay.
be what we code.
Or yep, for our ICD-10. So we'll go to fibrosclerosis. And then what anatomic location are we on for the fibrosclerosis?
The left breast.
Okay. So what's our code? We're going to go back to our tabular and further expand.
N60.32.
Yep. So we'll go to N60.3. And then we need the 3-2 for the left breast. Okay, so we're going to roll out letters A and C. And then we're going to go back to our CPT manual and we're going to go look and see what surgical pathology codes we need. So let's go ahead and just go to our 88305 area. And so we're looking for breast biopsy underneath our surgical pathology codes. So which of our surgical pathology codes are going to be for breast biopsy?
Oh, 5.
Yep, we're going to use 88305. Okay. So then that gives us option B, because we would not want to use 88307 instead because they only did one microscopic examination, right? So our option is going to be our answer is going to be letter B. Any questions on that one? Yep, and 88307 indicates that it's for margins. Yep. Okay, let's do our last one. It's been a while since we've gotten through all 10 questions in a session, so let's go ahead and do this last one here. A couple has been trying to conceive for 9 months without success. Preliminary studies show that the woman ovulates and the husband's sperm count is good. So a sperm sample is submitted for both a postcoital Huner test and a hamster penetration test.
Ugh.
So for this one, let's do process of elimination. So we have 2 codes or 2 options. Well, no, we have 3 options that have the 89300. So let's go look at our 89300. And then do we think our 89300, looking at our code description, matches one of our tests that we did? Yep. So it's for a postcoital Huner test. So we're going to use 89300. And then rule out letter D. And then the way that I would look at it is your 89310, or sorry, your 89320 and 29 are going to be pretty close together. Actually, they're all going to be right there together. So then what is our second code that we need for that hamster penetration test?
Oh, you highlighted 89330.
Oh, I did,
Mhm.
didn't I? Good catch.
It would
So we
be
actually
eight.
only have A and C.
It would be 89329
Okay.
because it says sperm evaluation hamster penetration test.
Yep. So for that hamster penetration test, we have our 89329. So see, if you're like me and you look at it too quickly, then you possibly could have, and they do that because they want to see if you're paying attention to double digits and if you're repeating a digit that shouldn't be repeated. So yeah, we want our 89, and I just crossed out the wrong one. I was supposed to highlight that one. So 89329 is our answer for number 10. So letter C. So any questions that you guys can think of? My brain is, Dawn, don't laugh at me because my brain is like, it's been one of those days today. Any questions that you guys can think of?
Not
Path and
related to the
lab.
question.
Okay. Yeah, Path and lab is a little bit more straightforward. I think it's just kind of one of those things that you've got a bunch of different things that can fall under Path and lab. Just a matter of what type of testing and things that you do. So just make sure from a testing perspective, just pay attention to your codes, especially in your surgical pathology sections. Make sure that you're not just looking at the type of specimen, but why we have the specimen. So that will really help narrow down a lot of your answers that way too.
Yeah, for
Okay.
me, it's just I've been dealing with a lot, not just the testing, but another personal thing. I've been dealing with a lot of uncertainty. So
Yeah.
like, it's just been hard. I mean, I try. I mean, I mean, this week I might take 2 days off of studying because I took Sunday off, and I usually like to take Fridays off, and then it's been kind of a hard time. I mean, I try to read through the guidelines once a week. Sometimes I read 3 pages, 2 pages, 5 pages of a day of the ICD 10 CM guidelines.
Mm-hmm. Yeah.
And I mean, what would you say to that? I mean, it's hard it's just with my autism, my mind is always, it's hard for me to stay focused even when I read.
No, don't overwork yourself because if you push yourself and you're not in the right mindset, you're not going to retain anything, right? So if you find yourself sitting down and you can't sit down and focus, then get up and walk away and do something else for a little bit and try to go back to it. It's going to be one
Yeah.
of those things that you're going to learn what is best for you and what's going to help the most for you. So if you have those days, I have those days. Okay. I work a full-time job. I do a lot of coaching. I do a lot of teaching. And then I'm also studying for another certification. So it's one of those things that I get it. Like there's going to be some days that your brain is not going to want to sit down and do it. And that's totally fine. Because I
But
even know for myself, whenever I have those days that I'm struggling focusing and I push myself to study, I don't retain any of the information.
well,
Um,
what I want to say is, like I've been feeling like this for like the past few weeks, just uncertainty and worry about a lot of things every day. I mean, sometimes it dies down, sometimes it comes
mhm.
back. That's just the thing that's hard. And I just feel like not studying, I just don't want to get in the habit of not studying for several days in a row. That's just the thing.
Yeah, yeah. Just take
And
it day by day.
I
Yeah.
mean, I just feel like I just worry that if I stop studying one day and then I'm thinking, oh, I'm feeling heavy this day and that, then I'm just going to get in the habit and then I'll never study.
Yeah, yeah. Just take it day by day and just kind of focus and just determine, if you know that you need to sit down and you need to focus, like somebody said, if you need to get up and walk around for a couple of minutes, do 15, 20 minutes here. Don't sit there and just cram for hours on end.
Like I
Do a
don't,
little
I,
bit and get up and move around and kind of like get a little bit of that nervousness and that anxiousness.
I mean, yeah, it's just like I said, I mean, and the other concern I have is like I see that my code book will be invalid through September 30th, and I would hope to get to take the exam before October 1st.
Well,
By the
so the books are good through the end of the year from a testing perspective.
and I
So
just
even though
it's
2025 books come out and they're effective 10/1 for a real world perspective, from a testing perspective, you will use your 2024 book all the way through the end of the year.
yeah, because my books were provided to me through the program that I studied in, and
Yeah.
I'm kind of tight with money and having to buy the new books. That's another thing that's kind of
Yeah. And you can even use your 2024 book in 2025. There's really
okay.
not many changes that have come out from 2024 to 2025. So it's one of those things that you can still use them next year. But you can't use 2025 until January. So your test for 2024 is going to use 2024 books all the way through December 31st. Okay.
And
So don't
and I
feel
feel
like you have to set a timeline for or a deadline for the end of September.
Yeah. And sorry, it's just there's a lot I have to say with regards to setting. I mean, I go through the chapters quickly in my book because I want to get this book done on time. I don't want it to be terribly long till I take the CPC or till I start taking the practice tests again because I that's just the thing that's hard. There's just a lot of uncertainty and it's sucking a lot of my energy away.
Yeah. Yeah. Well, just try to focus on what you can control. Okay. Because trust me, I know there's a lot of things in my life that I focus on it and it sucks. And, it sucks all the energy out of me. But if we can focus on the things that we can control, then that will help bring a little bit of positivity to it so that it's not so much well, I can't do this and I can't do that. Right. Focus on the things that you can do, and that will maybe help bring some of that anxiousness down.
Yeah, I mean, because the other thing that I'm preoccupied about is a thing that probably isn't important to other people. That if I'll just say, let me just leave it. It's a personal thing. It's just
Mm-hmm.
they're like, and I'm having and I think that thing is taking up a lot of my thoughts. And I mean, I'm trying to steady. It's just it seems
Yeah,
like
yeah,
even if I stopped thinking about this, even if I tried to stop with this thing, I'd still think about it either way.
yeah, yeah. Just like I said, just kind of do a little bit here, a little bit there. If you need to, instead of doing a bunch of it all at once and just studying for a couple of hours, do a little bit while you're waiting for dinner to finish cooking, or do a little bit while you're sitting at a doctor's office. Like just take your phone and have your digital copy of your guidelines and read through those.
Oh, I have
Find a little
I have on
bit
my
here and a little bit there.
I mean, I have pictures of the ICD 10 CM guidelines on my iPad and iPhone. I took pictures of them,
Yeah.
and because it was
Okay.
and it's just the CPT guidelines. I only read the guidelines at the beginning of each chapter.
Right. Yeah. So
Like,
as you're doing questions for that chapter, read over your guidelines.
yeah, like I'm done with chapter 3, and I finished chapter 4. In my study guide, and with chapter 5, it's just like I just like, and like you said about the guidelines, I don't need to memorize them. Just need to know where to find them.
Right. And just know when to reference them. Correct.
It's just remembering, like for sequencing sake. The only thing I can remember is like for burns, you code the highest degree burn first.
Yes. Mm-hmm.
Yeah, it's just, yeah, I wish I had a crystal ball, then I could know for sure with all this uncertainty. Well, thank you again, Tiffany. I really appreciate this group and I appreciate you.
Absolutely. You're very welcome. We'll chat next week. Okay.
Okay, good night.
Thanks. Bye.